and we'll be your virtual tour guides.
First stop on the tour is the Orthopedic Center on Ivy Road. Here you'll find our sports medicine and runners clinics, as well as our favorite department chair.
Say hi, Dr. Wilder.
Hi, Dr. Wilder.
Welcome to the EMG room. This is where we do nerve conduction studies and EMGs. Here at our program, we get well above the minimum required numbers of EMGs and nerve conduction studies.
Next up, the prosthetics and orthotics department. Here, we get a close-up look at the entire process of fitting a patient for a prosthesis, from initial evaluation on the clinic side to the entire fabrication process. There's a lot of creativity that goes into making a device that will best serve that particular patient. We also learn about other types of braces and sometimes even practice on each other. Don't worry though, no residents were harmed in the making of this film. This is the outside of the Orthopedic Center.
We like having lunch out here on nice days.
Clearly, it wasn't the nicest day, or lunchtime for that matter, on the day we filmed this, but you get the idea. That's more like it. This is from a nice sunny day where Dr. Wilder gave our didactic session out here. I almost forgot to mention the stunning views from the clinic windows. I mean, who wouldn't want to come to work every day? Next stop on our tour is UVA Encompass Rehab. This is the rehab hospital where we spend the majority of our time as PGY2 residents. There are 4 inpatient services, each with an excellent attending: SCI, Neuro, Ortho, and General Rehab, that the residents rotate through during the year. And look who it is in the resident workroom, your 2 favorite tour guides. You get very close with your fellow co-residents during PGY2 year, working as a team to help your patients. There is also teamwork on a larger scale, as you can see here in the daily interdisciplinary huddle. It's a lot of fun to collaborate with the therapists, case managers, and the rest of the team to produce the best care for our patients. And as you can see, we have fun while we're doing it too. We also spend time learning from our prosthetics and orthotics team about the various types of braces and how to choose which one would be best suited to our particular patient's needs. On a break, we like to go outside and enjoy some co-resident bonding time in the sunshine. Some of us really need to work on our hand-eye coordination. I also love going for walks around the building, especially when it's peak fall foliage like this. The colors are just gorgeous. Well, we'll see you at our next stop. Next stop is the 515 building at Fontaine. This building is directly connected to Encompass Rehab and is home to the majority of our outpatient PM&R clinics. Here on the second floor, we have the faculty member offices and also the PM&R library. It has actual books. The library is where we hold a lot of our didactic sessions. For example, we have monthly ultrasound teaching lessons where we cover a joint of the month. We review the anatomy and then take time to practice scanning on each other. This is a great opportunity to refine our skills so that we can feel comfortable and confident when we start performing ultrasound-guided injections in clinic. Other types of lectures include radiology rounds, where we review imaging from specific cases with a musculoskeletal radiologist, and our neuroaxial injection course as PGY 3s and 4s. Up on the third floor of the 515 building, we have our outpatient PM&R clinics, where we manage a variety of musculoskeletal conditions and perform procedures such as trigger point injections, Botox, and baclofen pump refills. It's also where you'll find our fearless leader and program director.
Hey, Dr. Jenkins.
Well, that's it for this stop. I'll leave you with this beautiful sunrise from the front of the 515 building. Next stop on the tour, University Hospital. UVA Medical Center is a 650-bed hospital and level 1 trauma center. As a PM&R resident, you'll mainly spend time here for consults. However, if you match into the categorical track, you will also have several inpatient rotations here during your intern year, such as internal medicine, emergency medicine, neuro inpatient, and neuro consults. You might even get to see some sunrises like these before neuro or medicine rounds. This is an example of a call suite that you might use on night float, although I hear these are being redone. This balcony on the 3rd floor of the South Tower is a hidden gem. It's so nice to come out here and take a break to get some sunshine or have lunch and just enjoy the view and escape the hospital for a little bit. There are several other clinics and administrative buildings right next to the hospital. For example, right across the street from the main hospital, we have the Emily Kirk Cancer Center. And right around the corner, we have UVA Children's Hospital, where you might spend some time if you're interested in pursuing peds rehab. We also use the medical school's anatomy lab to review anatomy and practice injections. I also wanted to show you guys some of my favorite spots around Charlottesville, starting with all the options for outdoor activities. There are so many easily accessible trails for running, hiking, and mountain biking. Some of them I can even run to from my apartment. If you're interested in a weekend camping trip, Shenandoah National Park is also less than an hour away, where you can get incredible views like these. There's also a great food scene featuring a variety of cuisines. And if you ever need a restaurant recommendation, Dr. Jenkins is your guy. There are also some fun bars like this rooftop one downtown. The weather's pretty nice here in Virginia all year round, but you will get to experience all 4 seasons, which is great because fall is the best and we have things to do like farmers markets and pumpkin patches, as well as some really beautiful foliage. In the wintertime, I love going to the Winter Wander light display at Boar's Head Resort, which also has both a golf course and driving range, which you can visit in the warmer weather too. In the summer, it does get pretty hot here, so a lot of the apartment complexes have pools. Another great thing to do is to check out the many wineries right around Charlottesville. There are so many options and they all have stunning views like this. And if you happen to be craving some time in the city, DC is only a 2-hour drive and Charlottesville Airport has some easy flights. We love having fun both during and outside of work. From celebrating each other's birthdays and holidays to organizing a very important research project, otherwise known as the Resident Tie Tasting Competition, playing Jeopardy for lecture and getting way too competitive, having fun in the therapy gym, playing games like pickleball with the patients, and trying out the light gate machine, to even just goofing off with each other every day in the resident workroom. Only when our notes are all done, of course. We also have some very talented musicians in the group who will play for the holidays, to celebrate someone's retirement, or honestly even just to brighten a patient's day. There are truly so many things that make our program unique, and at the end of the year, it's hard to say goodbye to everyone. But we make it special and celebrate with a ceremony to honor our graduates with all the residents and faculty. I hope this tour was able to give you a little bit of a glimpse into what it would be like to be a resident at UVA PM&R. Thanks for watching!
Welcome to the EMG room.